think you're stupid. The companies that have butchered the middle class with rising healthcare costs are now going to be the watchdogs on this issue? Give me a break. All right, here's what's happening here. HMOs, insurance companies, drug makers, and doctors are telling the White House they will voluntarily slow their rate increases down in the coming years. They are offering $2 trillion in spending reductions in 10 years. Let me tell you something, folks. That is absolute hogwash, and I do not buy it. The very institutions that have drilled the American people with double-digit increases year after year are going to cut us a break? Is this the reform you voted for? Now, the AMA, the American Hospital Association, the pharmaceutical manufacturers, and of all people, the SEIU, say that, hey, let's all make sweet at the White House today. The SEIU calls it a good start. Here's what the president had to say on it today.
The groups who are here today represent different constituencies with different sets of interests. They've not always seen eye to eye with each other or with our government on what needs to be done to reform health care in this country. In fact, some of these groups were among the strongest critics of past plans for comprehensive reform. It's a kind of broad coalition, everybody with a seat at the table that I talked about during the campaign, that is required to achieve meaningful health care reform.
You know, folks, I don't trust the people at the table with the president. I think this is a major head fake and open field running, trying to absolutely dodge any reform that's out there. Mr. President, don't fall for this. Don't fall for this. These groups are offering an olive branch, but I tell you what, to consumers on the first day, it feels like a Trojan horse. I think these groups are going to do anything and everything they can to derail any reform. Single payer, not at the table. Consumer groups, not at the table. Doctors who want real reform, they're not at the table. I don't trust them. Now, here's the pushback. The right wing is making the government the boogeyman, saying that they don't want the government between the patient and doctor. Listen to this.
The issue is whether patients and their families, along with doctors, are going to be able to make health care decisions. If we insert the government between the patient and the doctor, that's not where the American people want it.
They are concerned that Washington will overreach. They will put that congressional committee between the doctor and the patient. We have no place between the doctor and the patient.
The American people are worried that we're going to place government, or should I say bureaucrats, between themselves and their doctors.
They're pretty good, aren't they? I mean, they got it all written down, all on the same page, or they just happen to say the same thing. It should be noted, folks, that the same PR firm that directed the SWIFT boaters is managing the effort to kill health care reform in this country. That's CRC Public Relations. Now, Rick Scott, who heads up the conservatives for patients' rights, refuses to come on this program with me face to face. Americans, I think we got to watch our backside on this one. I just don't feel like this is headed for real reform. Now, that's just my opinion. I could be wrong on this. But I don't see everybody at the table, and that troubles me. And I don't believe that a bean counter from an insurance company is going to look after me and look after you when it comes to keeping costs down. So this is a real challenge for the Obama administration. Joining me now is Peter Orszag, who is the White House Budget Director. Mr. Orszag, give me some...
Otherwise known as a bean counter.
Oh, well, okay, that's all right. I think you count them better than the insurance companies.
Thank
we'll start
you.
with
I
that.
hope so.
Okay. All right. Give me some confidence tonight. I mean, I've gotten a lot of email today, people saying, you know, we're not so sure about this, that this is, number one, totally inclusive and we can trust these organizations. What do you think?
Here's the big deal from what happened today. These organizations, so the hospitals and the doctors and the pharmaceutical companies, which have never before, at least to my knowledge, ever said we can wring efficiencies and reduce costs out of the healthcare system, have now said we can do that. And the result of that will be lower premiums for families and lower costs for the government. Now, we do need to make sure they live up to it, and I agree with you on that. But I think this is a big step forward in terms of at least making the pledge and the commitment.
How can we trust them? They have double-digit us on rate increases. They have denied coverage. It just, in many respects, the quality is good, but the consumers in this country are furious about this. Now, why should we trust the people? It's like the fox guarding the hen house, isn't it?
Well, I think, again, we are seeing change. You, by the way, mentioned some of the opponents to reform highlighting the controversy over comparative effectiveness research, which would provide more information about what works and what doesn't. I was in the meeting with the president today when these folks came in. The American Medical Association and the pharma industry, both of which had raised some concerns about comparative effectiveness research, both embraced it in the meeting with the president today. I think that's a significant change.
Let's talk about what does 1.5% over 10 years mean to me and all of the viewers tonight who are saying, look at my health insurance costs going up. Equate that for us.
Sure. What it means is, and it may sound like a little amount, but as Benjamin Franklin taught us, the power of compound interest is really strong. If you reduce the growth rate by 1.5 percentage points per year, after 5 years or so, the average family of four would be saving $2,500. Over a 10-year period, we as an economy would save $2 trillion that we could put into education, into infrastructure, into trips to Disneyland, other things that we'd rather be doing with our dollars rather than unnecessary tests and unnecessary days in the hospital.
Mr. Orszag, why don't we have an actuary from the General Accounting Office or from the White House, from you for that matter, on what single payer would actually cost? It appears that single payer is totally off the table when surveys show the majority of Americans want that. Why don't we get the numbers on that?
Well, I think there have been a variety of studies done. I think the key thing that we're trying to focus on is reducing costs and expanding coverage. There are lots of different ways of doing that. I know you favor a single payer. Some people in Congress do also. But there are other ways of getting efficiencies out of the system in addition.
Okay. No offense on calling you a bean counter. I know
that's okay. No offense taken.
You
Can
guys
I be
are
a cool bean counter?
No, I don't think you're cold-hearted at all.
Okay.
I'm having a hard time because over the last 10 years, all of a sudden, they haven't done anything. All of a sudden, these companies are going to step up and say, hey, I can't wait to help. What can I do? I think they're afraid that what the American people really want is what they could get, and they don't want that. What about that?
Well, I think what they have done, though, is they said we want to be a positive force in reform, not, unfortunately, what happened 15 years ago, they were a negative force. They have stepped forward and said we want to get reform done. I think, frankly, it was clear to them that we were proceeding. We had a lot of momentum. We've got, if necessary, reconciliation instructions, which will help get this done if necessary. And I think that what they were seeing is, the train was moving and they wanted to try to jump on, and they stepped forward in a way that I haven't seen them do in the past.
All right. Mr. Orszag, appreciate your time tonight. Thanks so much.
Thanks for having me.
For more on this, let's turn to Senator Ron Wyden of Oregon, who has been, in my opinion, a healthcare hawk. Senator, good to have you with us tonight. You trust all these people that are just stepping up all of a sudden after years of rate increases? Do you trust how genuine they are tonight? What do you think?
Ed, what I'll tell you is I'd much rather have these people saying now that they're going to work with us rather than going out and spending billions of dollars to try to beat us. I mean, they literally spent enormous sums the last time, and they certainly could do it again. The real key, and I think you touched on it, is there are a lot of good doctors and hospitals, but I'm not going to take the fox's word that the hen house is safe. We're going to write tough reforms, particularly insurance reforms, into the law.
There's a difference between a pledge and a guarantee. The word we got today was pledge. Are you satisfied with that?
Absolutely not. And it seems to me, particularly on insurance reform, what we've got to do is write a law that outlaws cherry picking. These companies can't just take healthy people, send sick people over to government programs more fragile than they are. We need to write a law that outlaws discrimination against those who are sick. We need to write a law that ensures community ratings so that everybody gets their costs held down. Finally, we need to write a law that I think is the ultimate legal guarantee, and that's that all our people get benefits that are at least as good as members of Congress have.
Ron, this is the word trust in big, bold letters across the screen. You're asking, and the administration is asking, the American people to trust an industry that has really nailed us financially and hurt small business. I mean, I hope it all works. I hope there is going to be some real reform here. But I don't see the single-payer people at the table on the Senate Finance Committee. And, oh, by the way, meeting number 2 is tomorrow. Can you give us an update on that?
What we're going to be zeroing in on is cost, and I think you and I have touched on this, Ed. I think it is outrageous for a person who's middle class, who's underinsured, doesn't have much coverage, to go out and subsidize designer smiles for high flyers. What we've got to do is go after these ripoffs. It starts with insurance reforms and then particularly cutting the outrageous administrative costs in health care.
Senator, are you willing to use reconciliation on this to make sure we get health care reform in this country?
Ed, I have been able to get a big group of senators on both sides of the aisle, been working on this for more than 2 years, to say that we're going to support tough insurance reforms on a bipartisan basis. As long as we can do that, let's buck for 70 votes in the United States Senate and make reconciliation irrelevant.
And you think that Republicans are going to work with you in 2009 before the midterm? You think they'll give this president a victory?
I think those Republicans have got to go home and they've got to say to their businesses that they've taken specific steps to hold costs down. You start with the tough insurance reforms that I've got Democrats and Republicans behind, and you can do that.